Hi, everyone. This is Jamie Smith. Welcome to Nurse Deck Podcast. I will be your host today. And today we are interviewing Paule Joseph. Hi there, Paule.
Hello, Jamie. Nice to meet you. Thank you so much for inviting me to join you today on your podcast.
Yes, ma'am. We are so excited to have you and interview. So thank you for your time.
Absolutely.
So tell us, Paule, what drew you to the nursing profession, especially in nursing research?
That's such a great question and one that I get often. So interestingly, it might not be surprising, but my mom is a nurse. So I grew up watching her pretty much care for the whole neighborhood. So I'm originally from Venezuela. And, I remember growing up and my mom being the nurse in the community and people coming to her, asking her questions. And she's going around just helping, people. And I used to look at that and I just didn't think much of that. I just thought it was like, okay, I guess this is what she does and this is what we do. And, she pretty much did all of that for the whole time that I was growing up. So in a way, I think growing up, I was pretty much was like, I don't want to be a professor and I don't want to be a nurse, just trying to rebel against your parents' profession. And here I am, would be doing both things. So in a way, I would say that my mom was my first example of a nurse and really inspired me to do what I do today in terms of like helping people and just devoted towards caring for others. And research, I've always been interested in research, and I can place that also back to my time in Venezuela. While I was in high school and even before that, I was always that person, reading a lot or like interested in doing studies. And one of my first experiments was actually trying to understand the effects of mercury in the body using animal models. And, so I think back of that and I like to think of that as like my initiations in terms of research. Later on, I came to the US where I did first an associate degree in nursing. And while I was doing my associate degree, I didn't have much experience or engagement in research. And I think that was primarily because of the way the curriculum was designed. But later on, when I went on to do my bachelor's and then my master's and started working in the hospitals, I took every opportunity to engage in research. So I think that research was both working clinically and doing research has always been a calling for me. Just one of those people that want to know why we do what we do and trying to find, the answer to questions that we might have and by using data.
Thank you for that information. So I just want to make sure I wrap it up and make sure I understand. You said you're from Venezuela, is that correct? From Venezuela, and your mom inspired you. You looked up to her. She was a nurse, so you enjoyed watching her care for other people. You ultimately knew you didn't want to be a professor. You did not want to be a nurse, and you put the pieces together. You realized that you enjoyed doing a lot of reading. You enjoyed the chemistry, the details of mercury in the human body, and then ultimately led you to research. Is that right?
Yes. In a nutshell, I think that's what it is. I think like sometimes as a teenager, you try to rebel against the obvious, but the world has a way of coming back together and then bringing you back in sync. And here I am, teaching and doing research and doing clinical practice.
I think that's awesome. You're teaching and you're doing clinical practice and you're a researcher. I think it's great. Tell us, Paule, what made you into the person that you are today?
Thank you so much, Jamie, for this question. I mean, I don't think I can single out one particular person. I could say, for sure, my parents have shaped who I am today, but also other individuals like my teachers, my mentors. And, I would always say that every experience that we encounter in our lives shapes who we are. And individuals that you might even meet for 5 minutes might have such a long impression on you, and that you might remember them later on and remember that something that they said, and that also impacts the way you make decisions. So it's really hard to pinpoint on one particular person, but I would say it would be a conglomerate of individuals and experiences that have shaped me into who I am today.
So it's been your mom, your teachers, your mentors, and overall experience in life. Is that right?
Correct.
Okay. So, Paule, can you tell us more about your studies and the role of chemosensory and what inspired you to focus on this sensory research?
So that's a very good question. I think that's a question that I've gotten from the time I decided to do this work as a PhD student. So one of the things that was very interesting to me was the nutrition overall, but what impacts why we eat what we eat. And in order just looking more closely into that, the mechanisms of like taste and smell are ones that we often don't think about. It's not necessarily, until individuals have very severe deficits on their taste and smell, as we're seeing now in COVID, is that it brings them to the doctor, right? But when I was working in the clinic many years ago, especially working with patients that had weight loss surgery, is that where I started noticing these reports of these individuals saying that food didn't taste the same anymore. Way back when I didn't know all of the things that I know now in terms of mechanistically what could possibly be happening. But I would pinpoint that as the catalyst that led me to really studying this area of chemosensation. And who doesn't like a very tasty burger?
Right.
Or who doesn't like a very tasty ice cream? So again, if we look even at data, even during the pandemic, like taste is one of these things that have driven, one of the factors that have driven even consumers, and you buy something because it tastes good, right? So I think it's a very important domain to study, and that needs more work to be done in this area. And why not do it? And as a nurse, we have all of these different perceptions and experiences with patients that allows us to ask these questions.
I agree with you. It is an important domain to study. You said a second ago that a lot of times we don't even think about the sensories, like being able to taste. We just do it because it's natural. We're humans. We drink our coffee, eat, we enjoy it, move on with life. And then COVID comes, and then we have our patients who say, it don't taste right and it's off. So I agree. It is an important area to study.
Yes. And I think I was in the right place at the right time.
That's
at this
right.
time when COVID.
It's funny how things work out.
Yeah, definitely.
So what is the ultimate goal of your research?
So for me, I think that one of the most important things that I look forward to really achieving with my work is that we're able to find and understand mechanisms that lead individuals to have these alterations in taste and smell, but also that through our research, we're able to have concrete mechanisms that we can target by developing new drugs or repurposing drugs that might help in terms of bettering the symptoms of these patients. One of the challenges that we have currently and that has been highlighted through the COVID pandemic is the fact that a lot of these individuals who are losing their sense of taste and smell and are having these symptoms as part of their long COVID, is that we really don't have very good treatments that can help them and improve this. So I'm hoping that through the work that I'm doing now and the work that I'll be doing in the future, that we really can come closer. But one of the things that we learned through this pandemic is that one lab alone cannot tackle all of these questions. So it's critical that we develop collaborations, interdisciplinary collaborations that can allow us to really dive deeper into understanding these particular mechanisms.
I respect your work. I really do. This is the first time I've
Thank
heard of
you.
anyone, doing this type of research or work. So basically, you want to be able to find mechanisms that lead to the alteration of taste and smell, dive deeper to better understand it, and possibly, did I hear you right? You want to maybe find drugs to improve the system. Is that right?
Yeah, exactly. Just being able to improve individuals' symptoms. I'm not sure if like we can definitely find a cure for those that have deficits, but again, I think that if we can ameliorate symptoms, we know that when individuals that have these alterations, it impacts their quality of life. If we see even the reports that currently when those that are having COVID or have experienced COVID, one of the things they talk about is, their experiences. Like, imagine going to a wedding or even your own wedding and not being able to
Right.
taste the cake.
Right.
It's, or having your baby and not being able to smell that newborn baby born. So I think that, of course, we're looking in the context of looking at taste and smell in this context, but taste and smell impacts so many different domains of our lives. Think about going to the mall and going to the perfume line. You want to buy something that smells good, but what happens when you can't smell it, right?
Yeah.
And also like the safety implications of these deficiencies. Like if you have a leaky gas in your house and you can perceive that, that's a safety hazard. So you can think of how the different dimensions that this actually takes on and how relevant it is for nursing and nursing science.
Polly, thank you for your comment there. I'm just sitting here thinking about how miserable I would be if I couldn't smell, if I couldn't taste. You're right. It would negatively impact quality of life. What if I tried to go to my friend's birthday party or, like you said, a wedding, and I couldn't enjoy the taste of the food or the drinks? It would be miserable. So I
Yeah,
would want something
absolutely.
out there to improve my symptoms. So
No, you're
thank you.
absolutely right.
Yes. So, Polly, can you tell us more about the COVID-19 related chemosensory changes in your studies?
Yeah, thank you, Jamie. So, in particular, I mean, as I mentioned, this whole COVID-19 pandemic has highlighted the importance of the sensory system, specifically taste and smell, as we are seeing a robust number of individuals that initially had lost, but individuals that have not recovered. So, a lot of the work that we have been doing, and again, this is not work that I've been doing by myself. This has been part of a global consortium and that was created, co-founded by myself and other colleagues across the globe. And this was in particular for us to understand these chemosensory reports in individuals with COVID-19. So we have been able to publish a number of papers, and one of them was really to establish the fact that, these reports are real. Individuals are not confusing taste with the loss of smell. They really experiencing this taste and smell loss. And in particular, as I said, they're not necessarily getting better and they're having these lingering effects. One of the other things that this really pushed us to do is to really think about the outside the box on how we really needed to start assessing these participants from a long distance, considering all the restrictions that we had in terms of research. So through the Global Consortium for Chemosensory Research, which we call the GCCR, we have been able to really establish some groundbreaking work to highlight some of the sensory deficits.
Yes, I want to put that together to make sure I understand. You're saying that COVID-19 does have sometimes another individuals may have lingering effects on being able to smell, being able to taste. And so your research that you're doing globally, you're trying to think outside the box. You mentioned TCCR being able to establish groundbreaking work. What was that,
Yeah.
the TCCR?
Oh, it's the GCCR, it's the Global Consortium for Chemosensory Research.
Got it. Okay. Thank you for clarifying that.
Yeah, no, absolutely.
Polly, how does being a nurse practitioner and with all of your clinical practice being able to contribute to what you do now?
So that's another great question. So I think you just created a robust number of awesome questions to ask me. You know, one thing that has been very important to me as I embarked in this research world was to really not give up my clinical practice. So I think because my clinical practice has been fundamental in informing the questions that I'm interested in, whether it has been with chemosensation, with obesity, with nutrition. And I think that, you know, as a nurse practitioner, we have that lens, that clinical lens that provide us when these different insights about patients. And one of the important things for me is like, and I believe this still remains true, you know, I'm, if not the only nurse that is trained in chemosensory science on this area of research that I'm doing. And I'm hopeful that, you know, we can train more people in this area. But it really highlights to me the gaps that we have clinically in terms of having nurses and nurse practitioners and PAs and other clinicians really understand more robustly this chemosensory system. That is not something that, oh, it's there and, you know, it's something that we need to assess. And one of the challenges that we have had so far clinically is the fact that we don't have clinical guidelines that can help clinicians, you know, not necessarily assess and diagnose these clinical problems. So by the time a patient comes to us, as I said earlier, it's when these symptoms are really affecting them so robustly. But we don't have something like the Snellen chart that can be used to really, you know, assess vision, right? So we know that you have a 20/20 vision, you're okay. And if things are going off, on and off, then you're going to get glasses. We don't have that for the sense of taste and smell. So one of the things, and it goes back to your original question in terms of the goals of my research, from a clinical perspective, we've been able to really advocate for developing these types of clinical guidelines that is necessary for nurse practitioners like me and other clinicians to be able to help patients with these disorders.
I must say, I admire your work. So I want to make sure I understand. I want to make sure we all understand. So you're not giving up your clinical practice. You're working as a nurse practitioner. You're doing this research, plus you're a PhD student, correct?
Not a PhD student. I'm actually a PI. So I'm the one that leads the research. So I'm a principal investigator.
Wow. How do you find time to balance everything that you're doing?
Good question. You know, and I'll answer this question when a lot of honesty. I got to the end of 2021 when we needed to actually do this interview, and I found myself really burned out. And I think it was primarily from the fact that, you know, March 2020 came with this whole COVID situation, and it really pushed us to elevate the amount of work that we were doing to be able to help patients in real time and to really start gathering data again from in a real time perspective. So we really worked night and day. I mean, we published, we were very, very busy. And this pandemic has been going on for like now, you know, over 2 years. And, you know, you close and open your eyes, you realize, wow, in 2 years, I haven't taken a vacation, like a real vacation. So again, I think normally I've been able to do a number of things that have helped me stay sane and help me balance and find some sort of, harmony. Because I like to think about like work-life harmony in that way. So like normally one of the things that I've done for many years have been a meditation practice. You know, I'll be that person barefooted by my tree, just really grounded into the floor, just really trying to connect with the world and the essence of where we are today, and, you know, just breathing. So there's a lot of different things that I do. And also I have a family. So we have 2 little kids, and, you know, just really putting things into perspective in terms of what matters and their lives, and just being good examples to them. So, but I would say to anyone listening to this, it's just like, just really take time for yourself and reassess. Again, every 6 months, every 3 months, every week, if you finding yourself at a point of like being burned out, it has gone too far. And again, it's just finding what you love to do. I picked up painting, and I'm not a good painter at all, but I just figured that this would actually be helpful, even just coloring, but again, or doodling. So doing different things that could really help you stay in harmony with the rest of your life. So it's not all work.
I want to emphasize how you said to take time for yourself and reassess. If you find that you are burned out, find an activity, find something that makes you happy, take some time for yourself. And you mentioned stuff like painting, meditation, exercise. So thank you for that.
Absolutely.
You have to take care of yourself.
Absolutely. And then you cannot take care of anybody else.
That's right. So, Paule, what's the biggest challenge you have had so far, and how are you able to manage it?
Yeah, no, that's another great question, Jamie. I would say that I'm not sure if I would say one of the biggest challenges, but I would say, because we all encounter a number of challenges. And for me, I like to look at those as lessons and things that also shape who I am. But I would say that, as a Black Latina nurse, I have faced a number of discrimination, of racism. And one of the things that I have been able to do to be able to manage this, sometimes, it hurts. It definitely hurts. Some comments definitely hurt. I'm human. But I have learned to really have a sit at the table in spaces that may not have people that look like me, to be able to, again, educate other individuals, but also open opportunities for other women and other people that look like me. So I think we do need a lot of underrepresented scientists in research. In particular, we need more nurses who are of underrepresented group in science. So if I can be an example to these individuals, whoever is out there who's interested in this career path, I want to be able to mentor them. I want to be able to be there for them. So I looked at all of these challenges as an opportunity to learn and prevent other people from going or experiencing similar things that I have experienced. And I would say another challenge is we have a child who is autistic, and just being able to manage the clinical practice, being able to handle the research, and also just home. So I know that I talked a little bit about burnout a few minutes ago, and and sometimes we associate burnout only with our work, but as a caregiver, sometimes, and especially a caregiver that has a lot of clinical knowledge, sometimes there's a lot that is expected from you. So you also need to take time to reassess the situation, take care of yourself. So put that oxygen mask that they tell us to put on, and just breathe, to be able to just be there for everybody and in different situations.
Thank you so much for sharing that information. Thank you so much. And you mentioned discrimination, and I'm sure we've had people listening saying, yes, I respect that statement. So thank you. And I'm sure I have no doubt you set an example just now for others listening. So thank you for that.
Well, thank you for asking the question.
Yes, ma'am. So you mentioned being burned out. How did you go about identifying your own burnout? How did you know you were burnt out in the first place? And you mentioned a second ago being able to find activities. Are there other examples on how to deal with it?
Yeah, no, absolutely. I think that, just being honest with yourself. I think also realizing that sometimes you're losing enthusiasm and motivation for things that normally would bring you joy. So again, it's just taking that time to just breathe and realize that you're not a superwoman.
That's right.
You're not the super person. Like, you can't handle everything for for a period of time. And it's okay to say no. And I think that one of the challenges and one of the things that I had to learn in my career, and I need to do better at this, I really do, it's to really say no to when sometimes people ask you to do certain things, and you look at your schedule and you wonder when you have time to eat. So it's like just really realizing these things, but also asking for help. I think that sometimes um, you know we may not feel empowered to ask for help, or to just have someone that can help you be accountable for some of the things that you're choosing to prioritize at the particular point in time. So I think asking for help is critical, and that's one of the things that I've been able to do. So besides all of the different things that I shared earlier, it's just to really have someone to help me and assist me in just regulating my calendar, so I don't end up triple booking things. Sounds something like very simple, but again, it's help, and that is valuable.
That's exactly right. I like how you mentioned how we're not superheroes. We're nurses, we're strong people, we all work hard, but we can't work 24/7. We're human beings. We're not superheroes, just like you said. I like how you also said it's okay to say no, and to asking for help is critical, and you take time to breathe.
Yeah, no, absolutely. And the other thing I would like to mention is, you know, when we talk about self-care, I think often we forget to really think about our mental health. And one of the it's okay to have a therapist, to talk to someone. It's not it's I think there's so much stigma around these things,
You're
and
right.
when it
It
should
is.
really, like, I mean, we go to a primary care provider, right, when we have some pain. So if we're having some emotional pain, why shouldn't we go to a mental health provider, as a psychologist, and talk to them, and just have some sort of like um, mindful acknowledgement that our mental health is critical, because that also impacts our physical health.
You're right. There is stigma surrounding it, and just talking to people. Sometimes just talking can really help.
Absolutely.
What are your thoughts on having a support group, a community, and how do you think nurses can benefit from the NurseDex community for nurses?
It is imperative to have a support group.
Mm-hmm.
I think that I would have not, we are who we are based on the conglomerate that surrounds us. And our community, in my perspective, is critical. And, communities like NurseDeck are just essential for us to be able to thrive, to be able to network. A lot of, yes, we can get so much education and so many different things, but, the people who surround us are critical and important. And it's not only what you can gain from other people, but also how you can contribute to other people's development. And, one particular thing that's been important to me is elevating women, elevating girls, elevating others into places where they want to be, in places that where I am, inviting them to the table, inviting them to the room, inviting their voices to be heard. So I think communities like NurseDeck allows us to do that, to have a voice. I would have never thought that I would be doing this interview with Jamie. So I was really grateful to be able to have my voice heard, and hopefully for some of you who are listening, some of the things that I've been able to share today resonates with you. And one of the particular things that I want to make clear as we continue this conversation is that if you have any questions, just really reach out to others, and learn about their path, learn about their career path. And remember that you might have a mentor for your career, but you might also have a mentor and a coach about just life. So it's okay to ask these different questions, and just have someone you can reach out to.
I want to emphasize, I love the statement you made just a minute ago when I was asking about how do you think nurses can benefit from Nurse Tech's community? You mentioned networking, but the one statement that I love was that you said it's not just about benefiting yourself, communicating with others, but being able to, quote, contribute to others' development, elevating others, helping another person out. So I love that. Thank you for that comment.
No, and thank you for having a community like Nurse Tech. When I was back in school, we didn't have this.
That's
so
right.
this is great to be able to just, develop communities like this. So I'm really grateful.
We're grateful to have you, and I've loved this interview so far. Is there a topic that you would like to discuss or address that we haven't mentioned?
No, I think that I think all your questions were right on point. So I don't think I have anything else, unless there's one thing that has been of particular interest for the Nurse Tech community that you can ask me that I can probably chime in. I don't know.
Okay.
Just tell me.
Okay. Well, have you heard of or have you been on Nurse Tech Social? It's like a little mini Facebook. Have you been on
Yes. Cool. And there's also on LinkedIn. So I learned about Nurse Tech on LinkedIn, and I actually love seeing the magazine style that comes out, and then I was like, oh, this is really cool. And just to have a nurse on the cover of a magazine, so it's really neat and really inspiring, and I just never thought I would see that. So it's really been really, really exciting to really learn other individual stories and what have led them into the profession and how they're contributing. All truly inspiring. Nursing is really an amazing profession.
It really is. I agree. Thank you, Dr. Paule Joseph, for your time today on Nurse Tech Podcast.
Thank you, Jamie. Thank you, everyone, for listening. And again, reach out if you have any questions about my career path or any way that I could help make your dreams come true.
Thank you so much. Bye, everyone.
Thank you.